Cooke here, and I'm at the ALP National Health Policy Summit with Matthew Cooke. Matthew, could you just describe your role?
So I'm the chairperson of the National Aboriginal Community Controlled Health Organisation, NACCHO.
Right. Now, we've just had a session about a range of issues, but you brought up particularly some concerns about the way Medicare locals and PHNs have been set up in terms of what that means for Indigenous organisations. Can you just go through that?
Look, there's been a lot of discussion here today at the Labor Health Policy Summit around self-determining communities, and strangely enough, it's not just about talking about Aboriginal people self-determining in their local communities, but also non-Indigenous people talking about wanting to make community decisions about their health care and about health services and system within their communities. One of the important things I raised is that Medicare locals previously under Labor government and primary health networks now under the Liberal government actually have a key responsibility around empowering communities to make those decisions, be it through their boards of directors, clinical councils or their community advisory networks. One of the biggest issues is that Labor failed to ensure that Aboriginal community controlled health organisations who are made up of Aboriginal people from the coalface had representation of Medicare locals, and likewise we've seen the same with the establishment of primary health networks where Aboriginal community controlled health organisations were failed by the Liberals, are being left out in the makeup of their governance structures, their clinical councils and community networks. However, we did welcome Ken Wyatt, the Minister for Aboriginal Health's announcement this week, where he's strongly encouraged primary health networks to work with NACCHO and with our member organisations to not only lean on us for our over 45 years plus expertise and experience in delivering comprehensive primary health care, but also for the leadership that we can provide to other parts of the healthcare system on what reforms they can take to take a better focus on preventative health for not only Aboriginal and Torres Strait Australians but all of our community.
And is there a pathway for that he's outlined? Like, how do you think how can that manifest now?
Look, I think the opportunity is now that as Minister, he's reached out to the primary health networks, he's given them some direction on what they could do to better engage with us. He's opened the opportunity by specifically naming our sector, and I think now it's the opportunity for their boards and their CEOs and even those responsible within the Department of Health to say, okay, how do we start to ensure that this collaboration can come together? We've had opportunities in the past where we had sessions coordinated by the Indigenous Health Division where we brought the primary health network chairs and CEOs together with chairs and CEOs from our ACCHO sector. I think more of that needs to happen as we embellish this relationship going forward. Take heed of the Minister's advice because it is sound advice. It is what Aboriginal and Torres Strait Islander Australians have been calling for, and importantly, as we're discussing here today, very important at the Labor Health Summit, Health Policy Summit, is that notion of self-determining communities, and for us, as I said, that's been the plight of Aboriginal Australia for a very long time.
You also raised the issue of racism and racism in the health sector and put out a challenge to Labor about the implementation, if it takes government at some point, of the Aboriginal and Torres Strait Islander health plan.
That's correct.
Can you go into that? What do you want to see done?
Well, look, it was the Labor government that developed the National Aboriginal Torres Strait Islander health plan under Warren Snowden as the then Assistant Minister for Aboriginal Health. So we're very much encouraging today that the Labor Party would continue with that health plan, to continue implementing its strategies that were identified and worked out with Aboriginal people. Subsequently, the current government developed an implementation plan as a companion document itself, and again we're saying stay the course, continue to work with Aboriginal and Torres Strait Islander leadership itself so that we can improve the health and well-being of our people. If it was Labor policy in the past, surely it must be something that can be maintained by a potential future Labor government. And the good thing that has been spoken about, and Warren Snowden is here today, and we've heard Bill Shorten speak, we've heard Catherine King speak, but importantly they've said that they are willing to work across the floor with the government to have a bipartisan approach to addressing First Nations people's health and closing the gap. And that's something that we ask for. We don't want Aboriginal health to become apolitical or one side of the parliament. We want Aboriginal health and closing the gap to become the responsibility of all parliamentarians.
What's a priority action you could see for addressing racism in the health system? And we saw from the Misdo coronial inquiry,
Aboriginal engagement, Aboriginal involvement, and that's why I raised that notion about people talking about self-determining communities, and all saying, well, you got to make sure that policy, that high-level policy, comes down to the actual grassroots. It actually filters down from a minister making that declaration or a political party making that declaration, that it flows through into the government departments and down into practice with services that they fund. Aboriginal people being involved at all levels of the health system in the design, the delivery, the implementation, monitoring and review will ensure that we build more culturally safe environments and a health system for our people to access. And that'll address the systemic racism that we are facing. It is institutionalised racism in these hospitals, within these healthcare system that needs to be addressed. And again, if we take a focus on that, it is in the health plan, it is in the implementation plan as companion documents, and start to really put some effort around it and see government make some investment to it, we will address and overcome, or we will start to address and overcome racism within the health system, which for my people, Aboriginal and Torres Strait Islander people, is a big access barrier.
Thank you very much, Matt. I'm holding you back from coffee, so thanks a million.
Appreciate it.